Dr. Natasha Christa, welcome. Could you please tell us a little bit about yourself and your professional background?
So, my name's Dr. Natasha Christa. I'm a GP. I work in Spring Hill in the city in Brisbane. I have a particular interest in the immunisation area, which came about because I did a diploma of tropical medicine and health in Lima in Peru, and was working at a travel medicine clinic where we gave out lots of immunisations. And over time, then I had children myself and became more interested in the childhood immunisation side of things. And I'm now, that's my area that I'm particularly passionate about. I particularly feel strongly that all children should be immunised, that it's the single most important thing that we can offer children.
The National Health Performance Authority released its Healthy Communities report into childhood immunisation recently. What can you tell us about the results and why are they important for Brisbane's north side and the Moreton Bay region?
Right. Well, it's the first time that we've been able to, as Medicare Local, Metro, Brisbane North, been able to know what our statistics were. And what we've worked out is it's very exciting and good news that we have 96% of our Aboriginal and Torres Strait Islanders are fully immunised by age 2. And this was traditionally an under-immunised group, and now so we've got really an excellent result that we've got a high immunisation rates. In fact, it's actually slightly higher than our non-Indigenous population, which is the immunisation rate there is about 93%. Unfortunately, the statistics do tell us that that drops off by the 5-year-old. So the 5-year-old vaccination, which is usually given these days at age 4, that vaccination rate is down to 88%, so we still have got room for improvement, but at least we know with the younger ones we're getting a really high immunisation rate.
Okay, well I think there's a very important reason there is because in this environment we work closely with the parents and we are actually able to help channel people into the various medical centres, and it is one of the requirements of being enrolled in an early childhood environment that immunisation is kept up to date. I think that contact with the families is so important and it works well. I think one of the reasons why it loses a bit at the end when they start formal schooling is because the schools don't have the same contact with the parents as we do in this early childhood environment. And so we value that, and I think that is one of the reasons why we get good success rates with our records. Also, at this age, it's very easy for us as a centre to encourage the parents to, when the child turns 4, to make sure that they've gone and got their 4-year-old needle.
It's World Immunisation Week this week. What do you think are the important messages for Aboriginal and Torres Strait Islander families?
The important messages are vaccination is essential, vaccination is fantastic, make sure you get your child vaccinated. If they haven't been fully vaccinated, it's never too late to catch up. We sometimes will see families that are 6 months or a year or even 2 years overdue. Doesn't matter, we'd still like to see them, we'd still like to have your child immunised. Bring them to your GP or your Child Health Centre, Brisbane City Council or Aboriginal health workers and to be immunised. So it's an essential thing to do for your child. It's the best thing that you could do to protect your child against any of the vaccine preventable diseases.
And I understand that there is an additional vaccination that Aboriginal and Torres Strait Islander families or Aboriginal and Torres Strait Islander children can receive.
Yes.
Can you tell us a little bit about that?
Yes. Aboriginal and Torres Strait Islanders have got a slight tendency towards some certain diseases, and that is just by nature of their genetic profile. So it's important to have the extra. There are 2 extra immunisations that are available and fully funded, so they're free, that are given to Aboriginal and Torres Strait Islander children. So if you identify as a person of Aboriginal and Torres Strait Islander descent, and your child identifies as that, or you do for your child, there are some extra things that we can do to protect your child against diseases. It's important to let your GP know. They might not necessarily know that you're Aboriginal or Torres Strait Islander. Let them know and then go and get those extra immunisations.
And finally, how can parents find out more information about immunisation?
You can find out more about the immunisation from either from the websites, from the government immunisation website, or probably even better than that is to ask your GP or childcare worker or Aboriginal healthcare worker. In Brisbane, we are very fortunate to have some dedicated Aboriginal and Torres Strait Islander health clinics, and they certainly can help you, but also GPs, all GPs are trained to be able to know which immunisations, which extra immunisations Aboriginal and Torres Strait Islander children need. I think it's particularly important to realise that Aboriginal and Torres Strait Islander children, as well as all other children, are fully immunised, and timely immunisation is important. We know that especially in the case of whooping cough, which we're in the middle of an epidemic of whooping cough, that we really want to get the littlies vaccinated on time. And you can now start that from 6 weeks. So 6 weeks after birth, and then at 6 months, 6 weeks after birth, and then at 4 months and 6 months, then at 12 months and 18 months. So there's a number of intervals that we need to do. Then there's the 2-year-old immunisation. If we make sure we get timely immunisation, we're going to protect those vulnerable babies early. And these are the ones that are most at risk of whooping cough. If a baby is exposed to whooping cough, they may die from whooping cough, whereas an adult might just get a horrible cough for 3 months. It's annoying, but it's not going to kill them. And an older child will just get a horrible cough with the typical whoop. Babies don't necessarily get the typical whoop, they just get the coughing and then they go blue. So the main thing we really want to do for babies is to protect them by vaccinating them on time.